Harwell has not had its own GP surgery for over 40 years. A number of doctors have always lived in the village. We've gathered together 3 retired Didcot GPs who live or have lived in the village. Dr. Diana Scott, Dr. Bill Couldrick and Dr. Alan Wagner. And we're hoping they're going to talk about the recent history of medical services for the population of the Harwell area. So Diana, could you tell me when you came to the village?
Well, I came to, the first year, I came in 1959 and joined practice in Didcot. But I came to live in Harwell in 1960. When you say practice in Didcot, it was Didcot and surrounds. So we had patients in Harwell, Blueberry, Upton, the Mortons, Hendreds, the Atomic Site, sort of scattered.
And the practice you were working at in Didcot?
Well, when I came, it was 21 Hayden Road, which was the home of the senior partner, Dr. Winifred Davidson. We were an all-female practice.
Unusual in those days.
Well, yes. It was very difficult for a woman to get. I mean, most of the big hospitals, particularly in London, didn't take women.
But when you started in this practice that was in the home of the senior partner?
Yes.
How did it evolve?
Oh well, I mean, in Dr. Davidson's house, the poor patients, they would sit. There were a few chairs in the hall, and the rest of the time they sat on the stairs, which, I mean, wouldn't go down at all well now. But when we moved into the new building, we had a big waiting room.
Turn to Bill. You started in...
I came to Didcot in 1962, and I came to the village I think in 65. Before that we lived in Didcot. The practice at that stage was also in Hayden Road, number 7 Hayden Road. We practiced from a semi-detached house. There were 3 partners, Dr. Asbury, Dr. Lennox, and I was the 3rd. It was really very difficult in those days. I think the one thing that's changed when I think about it is communications. Because in those days we only had a receptionist for the actual surgery hours. After that the phones went through to the wives. We really had a very difficult task because they had to wait until we rang them back from a public call box. And so if there were any emergencies, they really had to deal with them, which was they had a very difficult time. And of course they all had young families and they were completely tied to the phone for most of the day.
All 3 wives were tied to the phone during the day on weekdays.
Well, in turn, in a rota.
Right.
They had a rota, and it was a great relief when eventually we felt we were able to employ receptionists for the whole day. Well, we were in Hayden Road from 1962 when I arrived, and then we had the idea of building a health centre where we could involve district nurses and health visitors and social workers all in one group. And this happened eventually in 1970. Now before that, you have to remember in those days, if you wanted a district nurse, you had to go and find her because she, or put a note through her letterbox because they really weren't available. And I went on a course called Early Years in General Practice, where they were talking about the attachment of health visitors and district nurses to practices. I came back full of enthusiasm for this idea and made an appointment to see the medical officer of health, who was stationed in Reading in those days because we were still in Berkshire at that time. And I went to see the medical officer of health, and by pure luck a new medical officer of health had arrived called Dr. Collington, and he'd come from Devon, where he'd started the process of attaching nurses and health visitors to practices. So we were really in a very fortunate position, and he was immediately enthusiastic about it, and before long we had health visitors and nurses attached to our practice in Hayden Road, which made a great deal of difference to the way we could practice.
Now you've talked about when you were in the practice, when you joined the practice. Were you living in Harwell from the start, or?
No, I lived in Harwell, I think, in 1965 and 1966. And at that time, of course, there was still a surgery in the village. Dr. Beasley had a surgery in his house in the village, but I think it closed soon after that, actually.
And how long did you live in Harwell for?
On and off, quite a long time. We moved between Harwell and Didcot for most of our lives. We lived in Yew Tree Cottage for about 15 years, and then we moved back into Didcot, and then eventually moved back to Harwell again. Let's
move on to you, Alan, and then we'll come back to some of the things that both of you have already raised.
Well, I'm the junior member here. I didn't join practice in Didcot till 1974. I joined what was then the Millen Road practice, 97 I think it was, I can't remember now, to what is now Woodlands Medical Centre on the site of Didcot Hospital. I'd been in the Air Force, I left, joined the practice here. At that time when I first came here, I rented a house in Morton, then we bought a house in Hagborn, then I went and worked abroad in the Middle East for 18 months, came back, and very soon after we came back to the practice in 78, we bought the house here, so we've been here for 34 years now, and lived in Harwell all that time. Our practice, I think, was slightly, very much as Diana and Bill have said, I mean, it was based in Didcot with the same sort of areas that Diana mentioned. I think what was perhaps different to us, which I don't think either of you did, was that we were a so-called dispensing practice. I don't think you were dispensing. Yes. This just meant that we could, for the villages, which obviously included Harwell, our patients didn't necessarily have to take their prescription to a chemist. We actually dispensed the medicine to them. This was possibly advantageous to them.
Would you like to contrast how the Millen Road practice was when you joined it and how it was when you retired?
I mean, it was a purpose-built, but on today's standards, a rather small building. But we had facilities for the practice nurse and district nurse and health visitors room. We practiced out there. We also had a branch surgery, but that was in Blueberry. Alex Beasley, who had run one here in the village, was a part of the practice, but before my time. The other person who was the senior partner in my practice when I arrived was Ian Richardson, who lived in this village for 50 years, I think, nearly, wasn't it?
Because when I came, Ian Richardson was not part of your practice.
He was on his own, wasn't he?
No, he was with a Dr. Horan, and they
right,
practiced in Park Road. And Ian was his assistant, and then I think Dr. Horan retired or died, I can't remember which. Ian took over, worked as a single-handed practitioner for several years, and then joined
Roger Cruikshank.
Right.
So at that stage there were 4 practices in Didcot, four separate practices. I think that the difference between now with Woodlands practice, Woodlands Medical Centre, which was purpose-built, say in the late 90s, is probably space more than anything else, and a lot of that space is not down to having any more doctors. It's all the ancillary staff, because general practice has become overrun with paperwork, basically, and that's perhaps something we might talk about later.
Of course, I think the thing you have to remember is that when we joined the practice, and the same would be true for Alan and Diana, we were on duty for patients 24 hours a day. You were sometimes in a situation where you'd been up 4 or 5 times at night, you still had to work the next day. And there were no part-time doctors that I recall, and certainly in Didcot when I came, everybody was full-time. So that's really a major change now, and practices are full of part-time lady doctors particularly. And that of course is because of the changes in the terms of service, so you no longer are responsible for your patients at night. And I can't ever see things reverting to what they were. I mean, I think I have to say, I think we were abused
Mm.
by patients. We were called for most trivial things. And it was always very difficult because people were phoning from call boxes and they only had 3 minutes. And so you really had very little conversation. And then you were left, they were cut off and you were left with the feeling, well, but I've got to go because I don't really know whether I should or not.
Modern GP, in many ways it must be terribly frustrating because there was, you know, a certain satisfaction, you know, in dealing with your patients all the way through. And although weekends, I think for me the weekends, well, I could go off and play my golf or do something else. Fortunately, you needed a hobby that you could do at home when you were on call, so having a large garden, it suited me in many ways. But the person I really felt was tired was my wife and my children, because they used to have to say, you know, can we do this, Dad? No, Dad's on call this weekend, because it wasn't just Dad who was on call, it was Mum, as Bill has already said. It was the wives who took, you know, a heck of a lot of responsibility. They were the ones who had to answer the telephone, often make decisions. If I was out on a call somewhere around the villages, one did got. No mobile phone in those days. Initially, when I came and started working, I'm sure certainly two for the other two, no pages even in the early days. What we had to do was, I often used to, if I was in a patient's house at the weekend seeing something and I was there for a bit, I used to say, may I borrow your phone please, and I just used to ring home here.
It's interesting that you say you asked patients if you could use their phones. Of course, in the 60s, there were very, very few people who had phones at home.
True, I wasn't in the dark ages.
We spent a lot of time running to the phone box.
In due course, big bulky mobile phones started arriving, and then
But what a blessing.
Well, I'm interested, Diana, I'm sure you didn't use mobile phones, you retired long before. Did you, Bill?
Well, it's when they came in, but they were, as Bill says, they were
I
great
only
big things.
remember having a brick in the last.
let's think of another aspect of technology and its relationship to practice: computing. Did you presumably retired, Diana, before computers came into
I
came into
haven't got a
practice?
computer and I'm not going to get a computer.
I used to do 25 visits a day. And that was largely because people didn't have transport. The fact that the communications were poor, so you were visiting people because they'd run out of money and you hadn't got the proper story. And so there were many, many more visits.
So that meant that with a village like Harwell, even if you didn't live in the village, you would kind of get to know the village to an extent and get integrated and know who lived where and what sort of circumstances they were living in.
Absolutely.
But I think that visiting, I mean, I know it took up a lot of time, but I think it was a good thing because you where they lived, how they lived.
Deliverers of babies at home in those days, carefully selected. We did a lot of deliveries at home. We did a lot of deliveries at St George's Maternity Hospital in Wallingford. I spent many nights on the road between Didcot and Wallingford.
But I think that had even changed by the time I joined the practice in '74. I mean, we still had, I think, the odd home delivery, and certainly used Wallingford quite a lot. But I think the home deliveries by, I would say, the end of the '70s we needed a lot of persuading, I think, in those days.
It was a national policy.
Exactly. I think it had changed, and I think it was, you know, something. But again, I think Diana's point about visiting and knowing the homes, you would be very much influenced because you knew the family and knew the circumstances. And I think that was something, and it would be true of Harwell and all the villages. I think, and what I think Bill said earlier about, you know, visiting and the people who called around unnecessarily in Didcot, and it was because a lot of it was they were unsupported families, where in a village like Harwell, where probably generations had lived there, you'd be much happier about doing a home delivery because
To know the family point of view, delivering a baby at home was really a very rewarding experience because you were really part of the family for the rest of their lives.
And that's one of the nice things about living in a village, even if your practice is in the town roundabout, that you did know the families, you knew them often